I'm really sorry. Actually, we had to disconnect that live session. So, after quite some time, now we are again going live. And today's session is something very, very special, very, very important. Today, आज के हम टॉपिक में कोशिश करेंगे कुछ ऐसे बातों को जानने की अबाउट मेंटल हेल्थ एंड इट्स इम्पोर्टेंस फॉर फीमेल्स अराउंड अस समथिंग जो कि हमारे घर में हमें बहुत इजीली बोल दिया जाता है दैट यू नो इफ़ यू नॉट मेंटली ओके यू टॉक टू अस हमसे गाइडेंस लो बट प्रोबेबली वी नीड टू अंडरस्टैंड दैट द गाइडेंस इज रिक्वायर्ड फ्रॉम आउट ऑफ द your homely household and everything. And today, for that exact reason, we have Dr. Charan with us, who is an MD psychiatrist and someone who has an experience in dealing with all these kind of situations. He has been giving therapies from a quite some time. So let's see if he's online and let's connect with him. Uh, and I believe please a lot of you please try and send us your questions down below because I believe hello Dr. Charan, how are you?
Hi, Dr. Pooja, I'm good. How are you doing?
We are perfectly fine. I was just giving you an introduction that, and I was also requesting our followers to please ask their questions in the comment sections below because I believe you can help them right here, right now. And if they have few queries, they can actually connect with you later after this live session also to just ask their few issues which they feel like that no one is there around to help them. So let's start with our today's live session. So, Dr. Charan is MD psychiatrist, and I'm really glad to have a live session with you, sir, because this is something we have been waiting from quite some time to talk about mental health. And someone who is into this field knows the exact practicality, I would say, the exact practicality in the context of Indian environment and how the Indian females, normal household females, have to deal with all these kinds of problems. So let's start it, sir. I was just going through few of your articles post today morning, and I found that you were talking about that, when a female is having any issue, she gets stigmatized by her male members. Can you please elaborate this thing? Because I believe if you elaborate this, I can connect with what you were trying to tell. But I believe अगर आप हमारे followers को बताएंगे ना, what you exactly meant when you say the word stigmatized by the male members. So can I understand this then?
So, not just in terms of mental health, but generally, problems of women are looked down on by men. Even if you talk
Okay.
about PMS, as a woman, you do have periods. Men are at a point in terms of, we have more or less the same hormonal levels till we reach, old age. But for women, it changes every 21 days or 28
Yes.
of
Yes.
your cycle. What people don't understand is that, in hormones, they just do not play a role only on the female reproductive organs like uterus and ovaries. They also play a role on the brain of a person. Even when you look at men, even men have female hormones, obviously not of the same proportion as women has. Even I would have estrogen and progesterone a little bit in my body, right? So even men tend to have mood swings. Men tend to get irritable, but they are understood better. But when women does it, it's usually stigmatized as that she's being difficult or she's being emotional, she's being sensitive. So much so that some husbands bring their wives to me saying that they make a card on her name and they say that
Okay.
my wife needs help. I ask her what's the problem. She doesn't happen to realize what's the problem, and then he
Okay.
answers for her saying that oh, she's having a lot. She's being very sensitive. Um,
Okay.
I see some words like emotional, sensitive, etc. are very subjective, right?
Hmm.
Between
Yeah.
both, irrespective of we both coming from two different genders, I could be more moody than you, or I could be
True.
sensitive than you. That doesn't mean I'm abnormal because there is no criteria to tell that this much emotional is normal, this much is abnormal. This much sensitivity is normal, this much sensitivity is abnormal. You can't tell. Unlike temperature, if your temperature is more than, let's just say, 99 degrees, I know that you have fever, high fever, right? But for emotions and mood, you can't quantify. So if the husband is uncomfortable with whatever wife is asking him to do, or be there for her, or be patient and all that, he thinks it's a problem. So in that way, I think it's it's definitely stigmatized women's mental health. And I think a lot of men also believe that they tend to compare women of today's generation with women of yesteryears, like
Yeah.
somebody to, like, your mom or your grandparent or your aunt or somebody, right?
Hmm.
Understand that time, we're in completely different time. Back in
Hmm.
the clear responsibilities or clear boundaries of what a man ought to do and what a female ought to do, right? I mean, even I'm talking about like medieval times where men hunt and women reproduce. That was
Yes, yes,
the
yes.
criteria. But as the times are changing, we call it evolution for a reason. As we are
Yeah.
evolving human beings, as from cavemen, today we are
Hmm.
urban jungle we are living in.
Yeah.
Men, women, there is no difference at all, irrespective of their anatomy and
Hmm.
physiology, all of that. So I think men
Hmm.
tend to think that, okay, my mother is very patient.
Hmm.
She through bigger struggles, but she
Hmm.
she kept the marriage going. She made a
Hmm.
big marriage, but you are not
Hmm.
doing it. You can't compare,
Yeah.
because yourself is
Yeah.
not your father. You're also very,
Hmm.
very father. So in that way, I think there is an unfair and women are at disadvantage. That's what generally mean by there is stigma, and there is a lot more, which obviously we'll discuss later.
And sir, at the same time, when you say that the women are stigmatized, even at the same time, I feel the males are also stigmatized with the feeling like you can't cry. मर्द को दर्द नहीं होता. The famous Hindi say. I think that's also pretty wrong. Because I mean, if a male comes to us and they talk to us at times, they are very, very sensitive to the level that they want to understand what my wife is going through and everything. And they often hear from their own family members कि तू ऐसा क्यों कर रहा है? Why are you being so sensitive about it? It's okay, it happens. This is like a vice versa situation, I believe. And this kind of understanding is required for both the genders at the same time, because why to just say कि मर्द को दर्द नहीं होता? We all have those P substance in our body. We do have these pain issues coming up.
This
Yeah.
मर्द को दर्द नहीं होता is, I think, ridiculous, some nonsense
Yeah.
derived from a movie, or someone who doesn't have substance in their body has said it, which is normal kind of, they should have got.
Yeah.
But yeah, like you rightly said, every gender or every age group, every human being is generally going there through their own struggles. But I think when it comes to men's mental health, a lot of the shackles are put upon by themselves.
Hmm.
I mean, I think if like as a guy, if you go to your wife crying for something, your wife will want to listen to you. Your wife will want
Yes.
out. They'll never say, "What kind of man are you?" I mean, yeah,
Yes.
some people might, very rarely, but most of them would be like, they'll obviously provide, tender love and
They will like this thing that,
yeah,
he's opening up. The
yeah.
relationship will become more profound in its own substance. That, he's getting connected to me. So I believe we should take it in a different way nowadays. All right. So, sir, we have few questions lined up for you. When we have seen in our clinic, since we deal with hormonal issues mainly for female issues, so for males also we have started from last 2 months. We have been seeing few thyroid cases coming up with male being in the thyroid issue, thyroiditis also and everything. So what we have found is there is always a mental cause behind all these hormonal changes to sprout up. Mental causes like trauma, which they didn't recognize as a trauma, firstly, and secondly, sometimes they continue dealing with this word called adjust kar lo, adjust kar lo, adjust kar lo, and slowly and steadily they develop all these hormonal changes in their body. So, what can you suggest a female who doesn't have any issues right now, probably is in her teenage, because most of our followers are in their teenage girls. They are looking out for building a new career and everything. What all steps they should start taking care from now itself so that they have this mental stability or a way of letting themselves out? What would you suggest them?
I think the first important thing is going back to basics of saying no to drugs, because the
Yeah.
amount of drug usage, when I say drugs, it doesn't have to be, some hard street drug. It can be as simple thing as smoking, uh,
Hmm.
or alcohol. Occasional as a party use, it's a very different thing. But people, I know many school going girls, boys also, because right now we're only talking about girls. That's why I'm talking about,
Yeah.
like,
Yeah.
people who go to college, people who are working, people who are stressed, or
Hmm.
people who lose weight. It's a new fad that smoking makes you lose weight. So
Oh.
smoke back to back, so they don't have appetite and they lose weight. So
Oh.
and some people who want to gain weight because they want to look a certain way, that they're taking cannabis, because cannabis can stimulate your appetite. But again, that's a
Hmm.
fad, because on long term use, cannabis completely abolishes your appetite. People don't
Yes. Yes. Yes.
know the science behind it. It's not. That's why doctors don't prescribe these drugs. When you say
Hmm.
drugs, prescribe, because these drugs, they're not medically helpful. Even
Hmm.
though drugs that medical doctors give, they have side effects, but they are well within the therapeutic, evidence
Yes. Yeah.
based.
Hmm.
So, say no to drugs, because any drug that you take,
Hmm.
smoke, drink, inject, whatever, all of it
Hmm.
is change the function of your brain. Sometimes
Hmm.
even structure on chronic use, but let's just talk acutely. It changes the function of your brain. Just like how your body runs on hormones, your brain runs on neurotransmitters or neurochemicals.
Yes. Yes.
I always tell, if your body is a vehicle, your body is a car, you need fuel to run it. You need electricity
Hmm.
or petrol. Just like that, your brain also needs some fuel. When you are altering the levels of this fuel or neurotransmitters in your brain by taking drugs, you're bound to have all kinds of problems. Not just depression, anxiety, because those are very clearly heard a lot by everybody. There are many other
Hmm.
psychiatric conditions and neurological conditions that you will be vulnerable to. And
Hmm.
the scariest part here is, unlike other tissues, brain don't regenerate that well. If I cut my,
Okay.
if I break my bone, it tends to fix, in particular
Yeah.
amount of, depends on, multiple factors. But for brain, the active brain grows only in the first 6 years of, after
Hmm.
6, if you observe a 6-year-old baby and me will have the same head circumference.
Okay.
My body is going to grow, my limbs are going to grow, elongate, but my head
Hmm.
circumference won't change. That's
Hmm.
because after 6 years, brain stops growing, right?
Okay.
Any damage to your brain after 6 years, unlikely it will regenerate. So saying no to drugs is very, very important. And second important thing would be sleep. Your brain needs rest. It needs to
Yeah.
fuel up. If you're not sleeping well, that's not going to
Hmm.
happen. Some of
Hmm.
us sleep maybe 10, 11 hours, but it's not continuous. Sleep
Hmm.
in between to the phone and again go back. That kind of
Hmm.
sleep can help. So you
Hmm.
had how to work on sleep. That's a whole different question altogether.
Hmm.
I think these are the two main tips I will give you. And the third most important thing would be stress management. See,
Yeah.
you can't eliminate stress. Stress is going to be
Hmm.
there to find you in different ways. It'll find through your studies, your exams, your marriage, your friendships, your neighbors. There are different ways wise how stress will find you. But
Hmm.
you have to know to manage the stress. For that, there is exercise, there is art, some kind of hobby, dancing. There are different ways for you to
Hmm.
stress. We call them stress busters, right?
Yeah.
So, do them. And also one important thing is for youngsters, don't take yourself too seriously. Like
Hmm.
what you are today, you're not going to be the same person like 30 years, like when you cross 30.
Hmm.
How you are today, you're not going to look the same.
Hmm.
Or what kind of people you like today, it might not be same. the person that you're dating today might not be even right person for you. So
Hmm.
don't take yourself too seriously and put yourself through trauma.
Hmm.
And fifth and last most important thing would be parenting. Your relation with your parents decides a lot of psychological factors.
Okay.
So I think, again, for all the young girls who's becoming parents, because they're not ready, but because they think that they have to give birth to child before 35 years of age,
Hmm.
think about it.
Hmm.
If you need to have a child, are you being forced by somebody to have a child, or is it your conscious decision? You and your husband, are you on the same page? Then go have a child. Otherwise, you don't have right to spoil someone's life, because parental neglect, we all talk about abuse, right? Abusing a child is criminal. Neglecting a child is equally criminal. It causes equal number of psychiatric and psychological problems. So
Yeah.
the two things I think one needs to take.
Wonderful, sir. Actually, you started from a fact which is for a matured person. Like you first told about not to have drugs and alcohol, and at the end you told about parenting, which is a futuristic step also, and it's also a message to all the parents out there to start taking care and talk to their kids. So I believe that was a very nice message that you gave us. So you talked about sleep just now, that you should be having a nice sleep, and suddenly we have been seeing that there has been a sprout of all these medications, I would say supplements, which are melatonin based. Something like there are few patents also I have seen latest. Are they good for a longer consumption, or should they take it as an SOS? I have been pretty confused about it, because a lot of my patients are one who are working in corporates, and with this वर्क फ्रॉम होम कल्चर उनका थोड़ा स्केड्यूल हैज डिस्टर्ब है ना मॉर्निंग में दे हैव टू समटाइम्स वर्क टिल लेट एंड देन दे स्लीपिंग इन द आफ्टरनून सो स्लीप इज all over मतलब messed up. So what is your suggestion about these supplements which are melatonin based?
I naturally tell everybody, look at all the natural ways. When I say natural ways, they're not supplements. For example, if you have vitamin deficiency, more than buying a store bought vitamin, looking at your nutrition, where are you going wrong? What is going wrong? Is it lack of intake, or is it actually not getting absorbed in your body? Getting assessed and getting evaluated by a doctor and nutritionist would be helpful. Same way, if you're not able to sleep, please get evaluated why you're not able to sleep. And
Hmm.
yes, you correctly pointed out melatonin. A lot of brands are coming up with it because you're
Yeah.
having sleep disturbances. And in terms of sales perspective, it's great. See, me as a person, I use melatonin. That's because whenever I frequently travel to any other country, which is in different time zone,
Yeah.
us, but like let's just say USA, we are in great time zone difference. Then
Hmm.
induced sleep, I would take melatonin for 2 to 3 days, so I don't have a gym,
Okay.
but I won't
Wonderful.
be sitting in my house in my comfort and then taking melatonin because I'm not able to sleep. That's not
Hmm.
good. Melatonin is a chemical that signals brain that it's time to sleep. That's it. It doesn't do anything more
Hmm.
than.
Hmm.
But if you're a person who is using your phone right before you go to bed for like 1 hour,
Hmm.
and you're
Hmm.
natural melatonin production by your brain, and then taking the melatonin from outside, it just doesn't make sense,
Hmm.
right? It's like you're damaging, uh, something of your, and then again you're trying to fix it. Instead of that, why don't we all look at not damaging it? Instead of that, why don't you start reading a book before you go to bed instead of screens? Or why
Hmm.
don't you avoid having any heated arguments right before you go to bed, or even for that matter, watching news that is very provocative.
Hmm.
Oh, if you turn on 9 o'clock news, my blood boils, at justice, and obviously, naturally, I won't be able to sleep. It tends
Yeah.
to disturb me either consciously or in the form of a nightmare.
Hmm.
So, so I think something in trying to it or undoing is not great. Instead, like look at what are the natural ways for you to fall asleep.
Yeah, so nation doesn't want to know at 9 o'clock what is happening around. We are already aware for the whole day what is happening around. Wonderful, sir. Actually, this was such a lovely session. I got so much actually as an input. that these are the basics we can start taking care as. And probably when we started this talk, we I really wanted it to be a women specific, genuinely, but you talked about all the things which I believe both the genders can start following. It is nothing very specific that girls have to do it or boys have to do it. You wouldn't do any sort of discrimination. Wonderful. And this is a message for both the genders. If you have a boyfriend or a brother or a sibling or a parent who is struggling right now with any of these issues, please transfer this message to all of them. It is nothing like that. It's only up to you. And pass on this message. And I believe today we won't have much of the questions in the comment section because mental health is still a taboo. I usually get most of these questions post the live session in my DM. So, sir, please be ready for all these kind of questions coming up after this live session in your DM, asking you all sorts of questions, all sorts of queries these people have been having in their lives. Because most of the girls, they struggle with a lot of confused state and all these issues. And I believe first of all, start taking care of these basics, and baki sab to would be taken care rightly. Any other message you would like to give, sir?
Because we're talking about women's mental health, one thing I want to bring up is, abuse has become very common against women.
Yes,
It
yes.
can be verbal abuse or psychological abuse.
Hmm. Hmm.
And, um, sometimes I think you get too used to abuse that you don't recognize it.
Yeah.
Um, so just wake up and shake yourself and understand that this is how you want to be treated. By it can be anybody. I'm not saying just men. This is not about hating men, right? It can be your own mother, asking you to stay quiet, like not to react or whatever, right? Speak up. It's always good to speak up. You don't have to yell or scream, nothing, but just speak up. The moment you stand up on your feet and be independent in every way. When I say independence, people usually think it's financial independence. I
Hmm.
mean emotional independence. I see a lot of couples coming to me where husband is doing a lot of wrong things, and women are psychologically dependent on their spouses. They don't react, or
Hmm.
they tend to blame themselves, thinking that maybe something is wrong with them. It
Hmm.
even to best of the independent working girls. It's not just exterior people. It's happening to young girls as well.
Hmm.
Um, so you have to become independent in that terms, that you're going to be okay no matter what, and with or without anybody. So please speak up if anything is putting you through trauma. You don't need There's absolutely no need. If somebody's not supporting you, it doesn't matter. You are your own self and you are enough. You're more than enough.
Hmm. Hmm. Wonderful, sir. Actually, यहाँ पे ना actually हमारे school में there used to be a poem every morning in the prayer by Rabindranath Tagore, where it was all about where your mind lets the freedom of the mind and everything. I believe it is not about the freedom of just as you said, finances. It's all about freedom of the thoughts and how you speak about it. You don't have to be a Jhansi ka Rani all the time. Just be a normal female or normal human and just talk about what is going in your mind. Wonderful, sir. Thank you so much, sir, for giving us this time in your busy schedule. I know it was very difficult for you to take out this time for us, but we really enjoyed your presence today. Thank you so much, sir.
Thank you. Thank you for having me.
Thank you, sir.
Take care. Bye.
Okay.